European agency calls for better pilot medical checks after Germanwings crash. London, Europe's top air safety body on Tuesday proposed a new set of medical checks for pilots and stronger medical oversight to address shortfalls highlighted by last year's crash of a Germanwings jetliner at the hands of its suicidal co-pilot. The Cologne, Germany-based European Aviation Safety Agency said pilots should undergo more thorough initial and recurring medical checks, including those for their mental health. When psychiatric conditions are documented, EASA is urging better follow-up of such cases. Germanwings Flight 9525 crashed on March 24, 2015, killing all 150 people on board on a flight from Barcelona to Dusseldorf when the 27-year-old co-pilot Andreas Lubitz intentionally flew the plane into the French Alps. Lubitz had a history of depression. He hid the condition from airline officials and regulators for fear it would end his career, investigators concluded. The crash spurred a number of safety recommendations, including from the French prosecutor probing the case and the France Air Accident Investigation Office, the BEA, which was formally charged with the crash probe. EASA also led a task force in the aftermath of the crash to explore changes. EASA said its latest proposal also calls for pilots to undergo drug and alcohol checks. The European Cockpit Association, a Brussels-based pilot lobby group, said it welcomed the proposals including early drug and alcohol testing. The earlier those aspects are checked the better, both from a safety perspective and to prevent that young people eager to become a pilot don't start costly training and pile up big financial debts, to then find out that they are not fit for this type of profession, said the group's Secretary-General Philip van Schotenthaw. Pilots still have reservation about later random drug and alcohol tests. The European safety regulator also called for training and oversight of aeromedical examinations, the checks pilots have to undertake. Physicians also would have to report any incomplete medical checks to authorities. EASA's proposal now goes to the European Commission, the European Union's executive arm, to enshrine the ideas in legislation. The safety regulator said it expected a legislative proposal to be ready by year-end. The BEA also suggested regulators should consider weakening doctor-patient confidentiality rules in the case of pilots if safety is at stake. EASA did not address the issue, though indicated it would provide the Commission with its view on how to balance medical confidentiality and public safety. EASA also said it is working on proposed changes to operational rules before year-end. Those would include establishment of pilot support programs, an agency spokesman said. Pilots have urged safety regulators to mandate that airlines provide access to such support mechanisms.